This is BoomerLife on CL 650.
Hey, and welcome back to the show. You're listening to CL 650, and we're talking about getting a good night's sleep, and thanks to SleepShop, your sleep experts, and Farouk Manji for setting up this great conversation today. From the University of British Columbia, we have Dr. Maureen Seresny on the phone, psychiatrist and co-director there at the Sleep Disorder Clinic. And as a psychiatrist, and we're going to talk a little bit about, bringing it all together here with SleepShop, what is your best advice for making your bedroom a place that is sort of a sanctuary for you? And Farouk's talked many times about finding the right kind of bed. That's obviously the business they're in. But it all comes together. You got to really feel like that's the place you, almost like my dog goes in his kennel and he feels safe there. That's your sort of safe place to sleep. Is that a good analogy?
I mean, having a comfortable space to sleep in, somewhere where you feel relaxed and rested, is really important. So, having a good bed can be part of that. For us, one of the things we're most often recommending is trying to keep that as a space just for sleep. Mm-hmm. A lot of times people have other stuff in the bedroom, televisions or computers, watching Netflix in bed. They're doing other stuff in that room that is requiring the brain to be alert or pay attention. And that's the wrong signal. We want that to be a place where the brain knows, oh, hey, it's time to relax and fall asleep. So especially for our patients who have insomnia, we try and get them to take all of that extraneous stuff out. It's fine if you want to read a book to wind down in the evening, but probably better not to do it in the bed. And definitely the electronics, because they have a bright, full-spectrum light coming from those devices, they can actually delay people falling asleep. It interferes with the normal melatonin production. Melatonin is a hormone that our bodies make naturally in the brain that releases when it's time to fall asleep as it's getting dark. And that gets turned off when we get a bright light exposure. So we usually recommend people to sort of wind down the electronics use in the couple of hours before bed.
Yeah, we had somebody else on a previous show talking about the spectrum of light, and a lot of the devices have a blue light, which mimics daylight, and that tells your brain. So maybe we should ask: Is there any advice for jet lag? I heard one time that you should go out in the late afternoon sun and wherever your destination is, and that sunlight later in the day helps to reset your clock a little bit and tells you that. That's telling you the time of day in your local time zone.
Yeah, so one of the things that's a little bit tricky is it depends on where you're going. Mm-hmm. Because our sleep schedule, it sort of runs on a specific cycle, and the timing of the light can have an effect, either moving your schedule earlier or moving your schedule later. So what I usually suggest to people that are traveling is to go online and look up one of the jet lag calculators. There's a few different websites. British Airways has one. Some of the university sleep programs have them, and you can look it up. It's called a jet lag calculator, and what it'll do is you put in the time that you're starting out at and the time that you're going to, and it'll give you recommendations about when to seek light and when to avoid light based on the number of hours difference.
Now, one thing we hear is that somebody goes to a hotel when they're traveling and they get a great night's sleep, and you're at home and you're not getting a good night's sleep. What happens? Do you think it's just something new, a different bed? Is it just a different experience?
Yeah, for some people, it is the fact that there's no stress when they go away on holiday.
Yeah.
So a lot of that stimulus to stay wakeful at night is removed by the fact that, they're not worrying about anything when they go away. For some of our patients with insomnia, they can actually develop sort of a habituated or subconscious component of it where the brain learns to expect bad sleep in their bed at home. Mm-hmm. So once in a while we'll see that, where if they're traveling and they're sleeping in a hotel, they sleep way better. Sometimes we'll even see them come into the sleep lab and they'll have a great night, whereas at home they weren't sleeping well. So there's some of that which is probably related to that expectation of bad sleep, which can be something that the brain is consciously aware of or something that it's not. But we will see that a lot of times in people with insomnia.
Is that something you can try, though, to say, okay, I'm not going to sleep in my bedroom. I'm going to sleep in the spare bed, in the spare bedroom?
Yeah, well, we do get that a lot in the clinic. Like, we'll have people who fall asleep on the couch, or they'll fall asleep in the spare room. Sometimes it works. Most times it doesn't. Or it might work once, but it doesn't, work on an ongoing basis. And, really, I think it's better to try and just have people sleeping well in their own bed. It's usually the most comfortable and the easiest. Now, there are some people where they have a partner who has a sleep disorder as well. And, for example, there's a lot of couples where one of the partners has insomnia and the other one has sleep apnea, or they both have insomnia, and they choose to sleep separately just so that neither of them disturbs the other one's sleep. So that's a bit different. But usually when we're working with people with insomnia in the clinic, we try and get them sleeping better in their own bed. Sleeping in the living room on the couch can be a bit problematic as well, because then there's less of a separation between the sleep environment and the non-sleep environment. So the brain can get a little bit mixed up about that, and some of the sleep scheduling issues can be a problem there in terms of, resting on the couch during the day or lying down to read on the couch during the day. And then when it's time to fall asleep at night, it can be a little bit confusing for the body's clock about, what time is it actually anyway, and am I supposed to fall asleep now or not? So we try to keep the sleeping environment consistent when we can.
That's Dr. Maureen Seresny from the University of British Columbia Sleep Disorders Clinic. Let's jump into sleep apnea. I'm sure that's a big part of what happens at the clinic. And
Sure.
And are people much more aware of this and the issues that come from sleep apnea, higher blood pressure, overweight, all those sorts of things?
I think that it's being recognized a lot more than it was. It's kind of an interesting condition. And when you look at the sleep field in general, a lot of the main discoveries in sleep are only within the last probably 50 to 60 years. It's a fairly new area of research as far as medicine's concerned. And some of the treatments that we have for sleep apnea have only been around since about the mid-1980s. So it's a relatively young field. But I think it's definitely getting to be something that more patients are aware of. I think more people know someone who has sleep apnea, and so they might start to wonder about it themselves, or people will be researching, I'm tired all the time, what's that caused by, or I have problems with snoring, what do I do about that? And that will come up. So I think it's definitely something that people are more aware of, and it is probably getting a little bit more common just for a couple of reasons. One is that as a population, we're getting a little bit more overweight. Unfortunately, that's the kind of the trend in North America, and sleep apnea can increase with being overweight. And also the population is aging, and sleep apnea is something that we tend to see more in people of middle age and older. Women, usually it starts a little bit later, mostly sort of menopause age or so. But for men, it can really start even in the 40s, and for some people before that, depending.
So how do you get diagnosed with sleep apnea? Do you need to come into the sleep labs there at UBC?
Well, usually the first step is to consult a doctor about it, and then they can organize testing for you. What we used to do is have everybody come in and sleep in the sleep laboratory and diagnose them that way. We measure breathing and oxygen levels and snoring, and we can tell what phases of sleep people are in and so forth. Some of the research that has come out, UBC actually was pioneering in some of this, looked at some of these home testing devices that are out and suggested that for people who are at high risk for sleep apnea based on physical factors such as, blood pressure and weight and neck size and age and those kinds of things, and also, family history or that kind of stuff. So we make a clinical judgment of that, and we say if this person is high risk, then some of these home-based sleep apnea testing devices can actually be quite good at diagnosing it, and that is helpful because usually we can get those patients tested quicker and treated quicker, and hopefully feeling better faster.
Well, as I mentioned, we have Dr. Charnel Muron with the oral devices that they custom make for many patients, and we're talked about, CPAP machines seem to be what has come forward, but a lot of people don't tolerate them well, and the people sticking with it falls off quite quickly.
Yeah, it can be tricky for people. It's how they work is it's basically a bedside air compressor on a small scale. So it's using pressurized air going to the back of the airway to keep that airway open so it doesn't collapse at night and the airflow is consistent and not restricted in any way. So the person shouldn't be having as much awakenings, ideally, and they shouldn't be having disturbances in their oxygen and carbon dioxide levels. In reality, sometimes it's very challenging for people to stick with the device because, it's a mask that you wear on your face. It's got a strap that goes around your head. It's connected to this air compressor by a hose and all that. So it's a little bit of an adjustment for a lot of people. And I find that, there are some people who struggle with it and maybe they use it a little bit or maybe they can't continue with it and have to try something else. And there are some people that we see that actually are really successful with it and feel a lot better when their sleep apnea is treated. We still recommend it as our first choice because it tends to be the best in relieving the airflow disturbance of sleep apnea. It's most effective at that out of all the different treatments that we have available to us. But we recognize that there are some people who just aren't going to be able to stick with it. And so that's where some of these other things like the dental appliances and some of the other physical devices, like there's another one called a tongue retaining device. There's a few other things like that that are being used, and those can often work quite well for people. They may not be as effective as the CPAP, but if we're at least improving the condition, for some people that really makes a big difference, even if we don't fully resolve it. And I think the best treatments are the ones that people actually use. It's great to prescribe a medication, but if it stays in the cupboard, it's not going to help somebody. So it's the same kind of thing. We have to figure out what people are actually going to use. And there's a lot of research going into that as well. Like keeping in mind, the CPAP devices have only been around for, 30-something years. So there's a lot of research going into how do we make those better, and also research into understanding what causes sleep apnea, and could we direct other treatment options at it based on understanding better how it works.
So with our final minute with you on the show today, for somebody that's maybe suffering with some kind of sleep issue, whether it's anxiety, sleep apnea, the insomnia, I guess the message is there's help out there, right?
Absolutely.
And
the first step really for most people is going to be starting out with your family doctor. We have the option to have you referred to a clinic like ours. There's a couple of other clinics around the Lower Mainland now that can offer help with sleep disorders. And our program actually sees people from around the province and actually even the Yukon. So it's definitely out there. And one of the big things that we're working on in our program is improving the access to the expertise that people need for sleep. So as we're moving into a new sleep program, actually, that we're building as we speak at UBC, we're looking at how do we get more resources available for our patients, how can we improve access to this expertise and knowledge. So
that's great. We have
focus.
A high-level clinic here in British Columbia. We're quite fortunate, for so many suffer from these issues.
Exactly. We're really happy to be able to serve our patients at a place like this, and we're so excited for our new clinic, which is going to be a real big improvement and a wonderful place to work, I think.
That's Dr. Maureen Seresny from the University of British Columbia Sleep Disorder Clinic. It's been a real treat having you on the show. Thank you very much for your insight.
My pleasure. Thanks so much.
And we'll speak to you another time. We'll hold you to it if you say yes.
All right.
Okay. Thanks
Sleep
a lot.
well.
Yep, I like that. All right.
Bye-bye.
Bye now.